Well, in geriatric psychiatry, you treat older adults.
Yeah.
And oftentimes the advice is like to listen to elders and like, of course, like rely on the wealth of experiences, like you mentioned at the beginning. What valuable lessons have you learned from your patients having like been in geriatric psychiatry residency so far?
Yeah. So I think one of like what I talked about a little bit earlier, like the one of the most rewarding aspects is the fact that the wealth of stories that um your patients do carry with them. It's incomparable the fact that they trust you with some of the things that they do share with you, and being you're in such a place of privilege to be able to kind of take little tidbits from some of those experiences. So when it comes to some things that my patient experiences have taught me, my patients have told me, it's that life is so short. It truly is so short. We can feel like we have however many years ahead of us, 60, 70, right? Years ahead of us before we think that we will then be in that position, but we don't know what can happen before then. So I think it's especially important, like with respect to our health and our well-being, knowing that we're in demanding professions, to be able to take care of those things so that, again, we can take care of the patient population that we're trying to look after.
Yeah, it's a great lesson, I would say,
Yeah.
to emphasize that life is short, and so to care for yourself, right? And another question, I guess, like I had related to like caring for people who are like of advanced age is what kinds of things have you learned for your own personal life about like seeing people age that like you've brought back to apply to yourself? And I'm guessing it would probably be in similar line to lessons of to take care of yourself because
Hmm.
life is short, but then also um, to care for yourself early on is like a really huge gift to yourself later on. Yeah.
Totally. And I think when it comes to prevention, that is what a lot of when we see people more so in the community or in outpatient type clinics, we talk a lot about prevention type strategies, right? So trying to keep the brain healthy, and what does that involve? So that involves your physical exercise, right? So I'm not a fitness expert by any means, but only within the last couple of years, I decided like something has to change. Life is going to continue being busy. I need to prioritize my physical wellness, my mental wellness, because there won't stop being another thing that I need to worry about, right? So those two pieces are really important. Nutrition is also really important. Again, they always say if you don't use it, you'll lose it. If you're like people are losing their hearing or having challenges with their vision, correcting that, right? So sometimes we do see patients who are admitted and their family member will then take their hearing aids home with them or their glasses home with them. And you can imagine that then that individual isn't interacting with anybody because they can't hear properly, they can't see properly. So then that can be very challenging for them. So giving them the best opportunity to be able to bounce back from whatever could be going on by offering them their senses back, right? So that they can do those things is really important. And then in addition to that, reading. Like I've started reading a lot more, but keeping your brain active. I'm a huge Wordle person. I'm still on that Wordle kick. Doing things like that it's incredibly healthy for your brain to just to challenge it a little bit and think in so many different ways than how you would normally think, like critically, Sudoku, word searches, things like that. They can be helpful, and we tell older adults to do them, but I think they could be helpful for anybody.